Hi, this is Jose with Transplants of Florida. Today, I'm coming to you to speak about guiding a patient correctly and educating them correctly so they understand fully what the whole restoration process is about. I always explain to patients that we're born with 100,000 follicles on our head completely, and then we bring up mirrors, we take a look at what their loss is. And let's say a patient is thinning in the front, the middle, and the crown. I'll ask them, what percentage of the 100,000 do you think you've lost? And sometimes the patient will tell me, well, I think I've lost 40, 50%. And then I'll explain to them, okay, let's be conservative and say 30,000, 30%, 30,000 follicles have died. Well, we only have about 8 to 9,000 follicles in our donor to be able to harvest and redistribute, because we need to leave hair in the back because we can't leave patients bald back there, right? So I explained to them, we can't expect 9,000 follicles to do the job of where 25,000 follicles used to be. So what we do with a patient that has very aggressive hair loss is we always start reestablishing their frontal hairline and working our way back. Why? Because the frontal hairline gives you the biggest cosmetic change. It frames a patient's face. It makes you look young. So it's the best investment of your hard-earned money, where to put them, so it gives you the biggest bang for your buck, right? So we also explain to patients that we implement something called dense packing, since we're already behind the 8 ball as far as numbers wise, 9,000 total grafts to harvest throughout a whole restoration process versus 25,000 maybe that the patient, 30,000 that the patient has lost. We implement something called dense packing. We transplant the fine 1s and 2s in your immediate frontal hairline, perfectly imperfect, so it looks nice and soft and natural. But then right behind the hairline, we do something called dense packing. When we're separating grafts under microscope, we leave a 2 hair graft and a 2 hair graft intact as one. And we transplant it as one. It does not look pluggy because it's only 4 hairs or 5 hairs. The pluggy look were 15, 20 hairs. So by doing that, we actually give the patient a look of more density with the same amount of grafts. So instead of transplanting, let's say 3,800 grafts in the front and mid area, and each of them in their individual little slits, it'll give you a certain amount of result, certain amount of density. We transplant 3,800 grafts dense packed into, let's say, 2,800 slits. And it actually gives you a look of more density. Actually, something else we also explain is some patients come in and they say, well, I want to take as much grafts as I can per surgery, and I want to transplant them from front all the way back. And we tell them that's not very beneficial because we're not giving you any density in any of the areas, and we can't expect 3,800 grafts to do the job of where 25,000 grafts used to be. So what we do is we start in the front, giving you as much density as possible. And then a second surgery, if the patient wants to do it, we focus more on the crown and we touch up the frontal 1 or 2 inches again, because it's the most important area. So I wanted to share this with you because one of the first and most important commitments we made at Transplants of Florida is to guide a patient correctly, dedicate ourselves to teach them about the whole process so they get a handle of it and they understand it, and make that commitment that is needed in the hair restoration process in order to be successful. So if you're interested in more information or you have any questions, you can reach us at 855-855-4310, or you can reach me directly, Jose Schmidt, Patient Education Director for Transplants of Florida, at jose@htof.us. That's JOSE at htof.us. We look forward to hearing from you.